The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, everyone. This is Karen Nickel, family nurse practitioner, and this is Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. A quick reminder about my course called the Perimenopause Answer. If you are going through this phase of life called perimenopause, I would love to have the opportunity to talk to you about the course to see if it's the right fit for you. There is a link on our website, itchyandbitchy.com, and our Facebook page, I and B Podcast, where you can schedule an appointment for a Zoom call with me. When you make that appointment, I'll be sitting at my desk waiting for you to join the one-on-one Zoom call. In my practice and in my course for perimenopausal and menopausal women, I have had some women who just have not been able to tolerate or have not done well with direct replacement of the female hormones estradiol, progesterone, and testosterone. In those cases, oftentimes they will do well with something called precursor hormones. Precursor means something that comes before another thing. When talking about hormones, it means hormones that come before or are converted into other hormones. So by supplying precursor hormones, you can help supply other hormones. Okay, let me explain. So let's start with a hormone called pregnenolone. Hang with me, pregnenolone. It is made from cholesterol. So I know we think of cholesterol as a bad thing, but it can do good things. We make pregnenolone from cholesterol, and pregnenolone is produced in the tissue of the brain, adrenal glands, and ovaries. Pregnenolone is the grandmother of most of our hormones since it can convert into progesterone, DHEA, testosterone, cortisol, and estradiol. All of those hormones. Pregnenolone can reduce the symptoms of menopause because it produces the hormones that we lose as we age. So let's say that we have someone whose estradiol, our most stimulatory form of estrogen that comes from our ovaries, estradiol, progesterone, and testosterone levels are low, and they have had side effects like breast tenderness or mood changes on HRT that included 1, 2, or all 3 of those hormones. So let's say they've gone into menopause and they had hot flashes and night sweats, they were miserable, and so we gave them estradiol, progesterone, and testosterone to relieve those menopausal symptoms, but in the effort to relieve those symptoms, they had side effects like breast tenderness, mood changes, puffiness, weight gain, irritability. Let's say they had all those side effects. And let's say the side effects could not be relieved in spite of trying different doses and different forms of HRT, like creams or capsules or pellets. We just could not find an HRT form or dose that would help their menopausal symptoms without giving them side effects. So that person may do better with a precursor hormone like pregnenolone. And why would that be? Because rather than the prescriber using trial and error to find the right dosing of hormones for the individual, a hormone like pregnenolone that has the ability to make all 3 of those hormones, which pregnenolone can do, it can convert to all 3 of those hormones, can be given, and the body does the conversion. Are you following me? So pregnenolone can convert to estradiol, progesterone, and testosterone. Now, it's not going to make as much of those 3 hormones as if we gave somebody those 3 hormones, but it may give just the right amount that that person needs. Also, using pregnenolone has benefits in addition to acting as the precursor of the other hormones. So, in addition to giving progesterone, estradiol, and testosterone, pregnenolone and the metabolites of pregnenolone have been shown to have anti-inflammatory properties. Its role in preventing neuroinflammation and enhancing neuroprotection has been well documented. So, protecting the brain and the whole neurologic system and reducing inflammation in the brain and the whole neurologic system has been documented. Protecting our neurologic system is a pretty terrific benefit, and studies have also shown that pregnenolone has antidepressant properties, improves memory and cognitive functions, controls pain, and relieves symptoms of mood disorder. One thing that hasn't been revealed in these studies is the mechanism behind the anti-inflammatory and neuroprotective functions of pregnenolone. We just don't know why it does what it does. Pregnenolone may play an important role in the body's response to stress. Industrial psychologists are those people who apply psychological principles to the workplace. So if you didn't know what an industrial psychologist was, that's what they are. So a group of industrial psychologists studied pregnenolone's effects on enhancing job performance in students and workers. They found that pregnenolone helped both groups learn and remember difficult tasks. Pregnenolone not only enhanced job performance, but also improved feelings of well-being in the test subjects. During periods of stress, the secretion of cortisol from the adrenal glands increases. In a study of Army pilots who are under stress, as one can imagine, it was noted that their increased output of cortisol caused increased fatigue in the pilots, resulting in poor performance. When given 50 milligrams of pregnenolone daily, their work performance improved with no adverse side effects. Pregnenolone can also improve immune system function and aid in weight loss by helping regulate cortisol levels. Additionally, pregnenolone can stimulate deep sleep, making it ideal for anyone who suffers from sleep disturbance or insomnia. Also, increased time spent in deep sleep can have a positive impact on mood, anxiety, and even memory. Pregnenolone is sold over the counter, but it is really important to work with a provider who knows what they're doing to help you with dosing and management of this hormone. Over-the-counter products come in capsules, creams, and oils, and pregnenolone can also be compounded. That has to be prescribed when it's compounded. Available oral doses typically range from 5 milligrams up to 100 milligrams per cap. Average cap dosing is 50 milligrams per day, and creams that are available range from 10 milligrams to 25 milligrams, with a 25 milligram dose of cream being an average dose. Oils can be found with a range of 10 to 20 milligrams per 5 drops of oil, and a 20 milligram dose of pregnenolone oil is an average dose. Keep in mind that high doses of pregnenolone can make a person irritable or anxious or cause headaches or heart palpitations. It is always best to start low and increase slowly. The most common side effect is drowsiness, so it is always best to dose it at bedtime. I'll tell you about another precursor hormone and what it can do for you after this quick break. Welcome back. The other precursor hormone we have, besides pregnenolone, is DHEA, dehydroepiandrosterone. I'm not going to say that again in the rest of the episode, and you're welcome. DHEA is produced by the adrenal glands, and adrenal production of DHEA begins during puberty and peaks at around 20 years of age. At approximately age 25, the blood levels of DHEA begin to decline, and by age 75, the DHEA levels are approximately 80% lower than they were at 20 years old. DHEA levels also decline under a variety of conditions of physiological stress, such as acute and chronic infections and trauma. Vegetarians have been shown to have decreased DHEA levels as well. In humans, healthy blood DHEA levels have been linked to bone and muscle health, feelings of well-being, improved concentration, long-term memory and cognition, improved pregnancy rates, lower miscarriage rates, as well as increased sense of vitality and better sex drive. Low concentrations of DHEA have been associated with underfunctioning, anxiety disorders during pregnancy, symptoms of depression, poor sense of well-being, and foggy thinking. Recent experimental and human studies show that DHEA is involved in a large variety of physiological processes, including immune function, brain function, bone metabolism, blood lipid metabolism, energy metabolism, the regulation of normal blood sugar and insulin levels, and the maintenance of lean body mass. I'm needing that about now. As I mentioned, DHEA is a precursor hormone. It can convert to two different forms of estrogen, estradiol and estrone, and it can convert to testosterone. Testosterone also provides benefits to both men and women. Testosterone helps build muscle and bone mass, aids sex drive, improves physical stamina, and sharpens spatial and analytical thinking. Since DHEA is a precursor hormone to testosterone, a group of researchers wanted to determine if taking a DHEA supplement would indeed improve testosterone levels. In 2020, this group of researchers did a meta-analysis of 42 publications and found that DHEA supplementation was indeed associated with an increase in testosterone levels. Taking DHEA supplements increased testosterone levels in all subgroups in the studies, no matter the age or health status. But the level of increase was higher in women compared to men. Interesting. The testosterone level increase was significantly greater in the subgroup who received DHEA doses of greater than 50 milligrams per day. But I'll talk about typical dosing for men and women in a minute. Just like pregnenolone, DHEA is available as an over-the-counter supplement. It comes in the form of capsules, creams, or oils, and the caps are typically available in doses of 5 milligrams up to 100 milligrams. The creams are usually available in the dose range of 10 to 15 milligrams per dose, and the oils are often 4 milligrams to 8 milligrams per drop. And DHEA can also, like pregnenolone, be compounded, and that is by prescription. The potential benefits of supplementing DHEA include improved bone density and muscle strength, decreased depression symptoms, and increased fat burning. Studies also show that DHEA may improve sexual function, fertility, and libido. Other studies have shown improvement in adrenal problems in women when taking DHEA. When supplementing with DHEA, women with adrenal insufficiency had decreased feelings of anxiety and depression and improved overall well-being and sexual satisfaction. For women, when taking DHEA in capsule form, it is usually dosed from 5 to 25 milligrams per day, usually in the evening or bedtime. Dosing for men is often 50 milligrams to 100 milligrams per day, and also it is dosed in the evening or at bedtime. For women using DHEA cream, dosing is usually 10 to 15 milligrams daily, and DHEA oil dosing is usually around 8 to 16 milligrams daily. If the dosing is too high in women, it can cause oily skin, acne, and frontal hair loss, all of which is usually not what we're looking for. Using precursor hormones provides specific benefits whether or not you take them with traditional hormone replacement of estrogen, progesterone, and or testosterone. For some women who don't want to or can't take estrogen, progesterone, and testosterone, using the precursor hormones of pregnenolone and DHEA that indirectly provide estradiol, progesterone, and testosterone may be a really good option. Typically, the beneficial effects associated with DHEA may be primarily seen in those with low DHEA levels or certain health conditions that I've reviewed with you. For young, healthy individuals who are having no symptoms, taking DHEA is likely not necessary. This hormone is produced naturally in the body, and more of it is not necessarily better if your levels are healthy. However, supplementing with DHEA may benefit some individuals, specifically older adults and those with certain adrenal or sexual or fertility problems. Of course, this is something you should discuss with your healthcare provider to make sure this is a good option for you. I just want you to be aware that this option is out there and could be something that might work well for you. Thank all of you for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings really do matter. Also, make sure you follow the show so that it will be automatically downloaded. Just click that follow button. That really matters too. I encourage you to visit our Facebook page, IMB Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. On the Facebook page and website, we have the information about how to schedule an appointment with me so we can chat about how my perimenopause course can help you if you're going through this phase in life. As always, thanks to Forrest Winsel, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you, Forrest. Forrest has completed his first very successful year at Peabody Music Conservatory. Amazing. I'm so proud of him. And remember, everyone, your health is in your hands.